The federal government has established a national mental health scheme for victims facing mental health challenges and stigmatization within the country. The Director of Public Health at the Ministry of Health, Dr. Alex Okoh, made this known while speaking to newsmen in Abuja during updates on COVID-19 response and development in the health sector in Abuja. Dr. Okoh says the scheme will help coordinate effective treatment, national response, and facilitate development of relevant mental health policy programs and intervention in the country.
The Federal Ministry of Health has established the National Mental Health Program to coordinate a national response and facilitate the development of relevant mental health policies, programs, and interventions in Nigeria. In recent years, there has been increasing acceptability of the important role mental health plays in achieving global development, as illustrated by the inclusion of mental health in the Sustainable Development Goals, with one of the targets being to strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. It is also pertinent to note that universal health coverage cannot be achieved without mental health. This necessitates an increased investment on all fronts for mental health awareness to increase understanding and reduce stigmatization of mental illness, to increase access to quality mental health care and effective treatment, and for research to identify new treatments and improve existing treatments for all mental health disorders. We must deepen the value and commitment to give to mental health as individuals, communities, and governments, and match that value with more commitment, engagement, and investment by all stakeholders across all sectors. We must strengthen our mental health care to improve accessibility, affordable and quality services, and support for mental health services delivery in Nigeria. The Federal Ministry of Health, through the National Mental Health Program, has done the following: developed a mapping tool to identify mental health stakeholders in Nigeria as a prelude to strengthening multi-stakeholder collaboration, facilitated the finalization of the WHO implementation toolkit for the integration of mental health care into care of people affected by neglected tropical diseases in the primary health care setting, initiated collaboration with MPHCDA to integrate mental health care with other services at primary health level.
We're all aware, ladies and gentlemen, of the dismal health indices that continue to bedevil our nation. And most of these are nonetheless because people who need emergency medical care, be it women and children, be it people, women who have obstetric situations, maternal and child, road traffic accidents, infants who are sick, people who have suffered injuries from the fact that there has been a lot of gunshot injuries around us. All of these do not get medical care on time. What then happens is that there's a dismal incidence of high mortality and extreme morbidity rates that have continued to plague our nation. It is therefore known that the way that Western countries and other more advanced countries have reduced these mortality figures and improved outcomes has been to make sure that there is a virile and active emergency medical service that can come to the aid of citizens whenever they need urgent emergency care. That has been the goal, and that has been what the Honorable Minister of Health has personally led to make sure that NEMSAS takes off in the country and NEMSAS becomes one of those established entities that actually provide care in Nigeria.
So beyond that, we have also gone out, sent officers out to sample, to find out if we have, but remember, this is in the Gambia. Fortunately for us, we do not on record have those products, but we know how sometimes how the borders can be, or how people bring them in even unregistered, because by our records, none of those cough syrups are registered, and ordinarily they shouldn't be in this country. But in spite of that, we have sent out messages to all officers in all the states in Nigeria, 36+1, including the FCT, to go around to find out if these products are in any shelf anywhere. We have written to all the industry stakeholders, the different, to PCN, to PSN and all stakeholders, so that if these products are anywhere, they can be retrieved and brought to us. So far, that's all we have done.